This is Nightline.
We're taking a look at a complicated medical procedure that's changing women's bodies and lives after cancer. Many survivors confront unexpected challenges after the battle, and for the women you're about to meet, mastectomies brought their own host of problems, not just physical, but emotional too. They told ABC's Cecilia Vega about restoring their breasts and their self-esteem.
From Angelina Jolie,
I really didn't know how people would react,
to Juliana Rancic,
I just wanted to get the cancer out,
to Christina Applegate.
I had a prophylactic double mastectomy.
Some of Hollywood's biggest stars are going public in the press about a very private matter. Jolie shocking Tinseltown in 2013 with her decision to undergo a double mastectomy after doctors told her she had an 87% chance of being diagnosed with breast cancer.
I didn't expect there to be so much support. It's connected me so much to other families, other women.
Other women like Jennifer Fisher. She knows what it's like to get that terrifying diagnosis and joins the 100,000 women having mastectomies each year, that number rising significantly in the past decade.
When I was first diagnosed, and even to this day, sometimes you get discussion of, well, you're here. Like, you're here, you're a survivor. Like, that should be enough. Can you put them on that end if you want?
Today, the wife and mother is a breast cancer survivor and much more. She's loving the results of a cutting-edge transplant surgery that takes extra fat from the stomach and uses it to make new breasts.
Happy with what you see?
Oh, absolutely. I couldn't be happier. There's a part of me that wishes I would have done this sooner. I think I would have been able to put some of these feelings behind me sooner.
Implants are the surgery of choice for 80% of reconstructive patients. The alternative surgery, called the DIEP Flap, takes longer in the operating room and comes with a longer recovery time, but Jennifer says it was all worth it.
You know, a lot of women who are going through recovery from breast cancer think they only have one option. You would tell them otherwise?
Absolutely. I would tell them to seek all options available.
Yeah.
Kim Jordan is heading into the hospital for the same surgery that Jennifer had. How she'll look when it's all done is the last thing on her mind.
Okay, you guys ready?
And I'm thinking, get the cancer out. I didn't really care, just get the cancer out, because I need to beat it, because nobody in my family beats it.
The 50-year-old subway conductor can rattle off a long list of relatives she has lost.
This is my sister Giovanna, who passed away from cancer of the lungs and brain, and my brother Mike, my oldest brother, he died of leukemia.
That's why when she got the diagnosis of very early breast cancer, she decided to get a double mastectomy.
Ready for our little adventure?
Yes.
Los Angeles plastic surgeon Michael Newman is one of just a few hundred doctors around the country who perform this relatively unknown operation.
I think some plastic surgeons out there decide that it's too complex for them to do, and I think some patients do better with a simpler surgery.
You're going to wake up, you're going to see a lot of people, and then you're going to go back to sleep.
It is, very detailed, and it's probably one of the more complex surgeries that we do.
I'm just worried. I just want to wake up. That's it. Just promise me I'm going to wake up.
The reconstruction will take all day. It's too complex for Dr. Newman to do alone. This is his partner, Dr. Lisa Jewell.
I love doing the surgery. It is very scary sometimes. But at the end of it, this patient's going to look better after what can be a devastating experience.
So the amount of tissue that we're going to remove off her abdomen is probably going to be like 5 pounds. She's definitely going to look thinner.
8 hours into surgery, it's time for the riskiest part of the operation.
And this is the part that we lose sleep over. This is an organ transplant, like a kidney transplant or a lung transplant. And then you have to connect it to a reliable and steady blood supply. So we could make a great breast, and then 1 or 2 days later, a tissue dies. And so in that case, we would have to perform another type of breast reconstruction.
But if successful, the transplants will grow with her body over a lifetime and will not require replacements like artificial implants do. The procedure is covered by insurance, which is a good thing because otherwise the cost would be prohibitive.
And then what else do you have?
Jennifer Fisher's DIEP Flap surgery was just 3 months ago, but her journey has been far longer. When Jennifer's daughter, Katie, was just a toddler, she got the diagnosis.
Really, at that moment, you change. You no longer are a mom and this and that. You become a person fighting this for everybody else. and yourself.
She had her breast removed and got an implant, but it never felt quite right.
I was always uncomfortable with the results. I had a lot of pain. Even with the implant, I needed to wear a prosthesis. I would have never worn something like I'm wearing now.
When she went in to get her implant checked 2 years ago, doctors found more cancer. This time, Jennifer decided on the DIEP Flap.
We eliminated the implant, we gave her healthy tissue that's soft, and gave her a fantastic abdomen at the same time.
Immediately when I went to her, I felt that she understood what I was looking for.
It was a huge lifestyle issue for her. She can't go the rest of her life with this constant reminder of pain, not feeling like she was ever happy with her reconstruction for the rest of her life.
The surgery motivated Jennifer to make some changes. She lost 30 pounds through exercise as she prepared for surgery.
She looks great. She has gotten very, very skinny, like really, really skinny, and I'm really happy for her.
I think we have plenty.
Back in the OR during Kim's surgery, the doctors are ready to shape the new breasts.
Patients often will use this opportunity to change their breast size. So this patient specifically asked if she could be smaller.
And she has breasts that are going to look and feel and age and change like breasts, natural breasts. Yeah, she doesn't have cancer.
15 hours later, they are finally finished.
All right. Good job, team.
You're going to feel really tired when you get home.
The recovery, long and painful.
I can walk a little bit now, but I'm getting there. But I'm cancer-free.
Yeah.
Hey there.
Okay, Dr. Newman.
But for Kim, no complaints.
Can you already see the difference?
Yes.
Tell me, what's the difference?
I have nice knockers, dude. Nice ones.
Jennifer is happy too. She's no longer afraid of wearing form-fitting clothes. She's more active than ever.
Dr. Jules kind of liberated me a little bit to say, you deserve to have the body you see yourself having.
A survivor first, but also proud to feel good in her own skin. For Nightline, I'm Cecilia Vega in Torrance, California.